Hello everyone, thanks for watching another video on our channel. Today, we're going to talk about metformin and address some of the most common questions related to it. You take metformin, the glyphage, for diabetes, prediabetes, for liver, or even off-label to lose weight and got worried. Have you heard that this medicine is bad for your health? Well, that's what today's video is about. I'm sure you'll discover a lot of news in this video, a lot that no doctor talks about, and you'll be relieved when you finish the video. So stay until the end because you will know everything about the most prescribed medicine. Worldwide for diabetes, more than 130 million people use metformin every day. But first, enjoy the video, subscribe to the channel so you don't miss our tips, health, and turn on the bell to receive notifications. And it is also very important that you share this knowledge with your friends and family. Because when it comes to your health, our health is worth sharing. So share there. And tell me, do you take metformin? How long? What part of the US or world are you from? Write down there. But does metformin cause cancer? Can it prevent diabetes? Does it attack the liver? Is it harmful to health? Let's go. Did you know that metformin comes from a plant? Yes. Metformin is a drug that was developed in the 1920s. Initially, the active substance was found in a plant called Galega officinalis, which was used to treat diabetes before the discovery of insulin. Over time, scientists isolated the active substance from the plant and chemically modified it to create the metformin that is used today. Metformin has become one of the most common drugs for treating type 2 diabetes and is widely used around the world. It is important to remember that while metformin is a safe and effective medication for many people, it may not be the best option for everyone. So metformin has been in use for over 60 years, almost 70, and it's the first-line starting drug for most type 2 diabetic patients. And, through the study, DPP, Diabetes Prevention Program, saw that, in the other group of prediabetics. Does metformin, glyphage, prevent a prediabetic from becoming a diabetic? Who used metformin 850 mg twice daily? There was a reduction in this group's risk of becoming diabetic in 31% compared to the placebo group, in less than 3 years. How does metformin work to lower blood glucose? Metformin works in several ways to lower blood glucose in people with type 2 diabetes. First, metformin decreases the liver's production of glucose. The liver is responsible for producing glucose in the body, and in people with type 2 diabetes, the liver can overproduce glucose, which leads to high blood sugar levels. Metformin helps reduce the production of glucose by the liver, thereby lowering the amount of sugar in the blood. In addition, metformin increases insulin sensitivity in the cells of the body. Insulin is a hormone that helps cells absorb glucose from the blood. In people with type 2 diabetes, cells may not respond properly to insulin, which leads to high blood sugar levels. Metformin helps make cells more sensitive to insulin, allowing glucose to be absorbed more easily by cells and thus lowering the amount of sugar in the blood. Metformin is a commonly prescribed drug to treat type 2 diabetes by helping to control blood sugar levels, and self-medication can be dangerous and should be avoided. Starting with the first question, there is a lot of confusion surrounding the supposed cancer risk associated with the use of metformin. However, recent research from observational studies concluded that metformin reduced the incidence of cancer by 31% and cancer mortality by 34%. Again, it is not possible to guarantee that metformin reduces the risk of cancer because these are observational studies, but it really has a chance of reducing risks. But also, research has not shown any relationship between metformin and cancer. On the contrary, there are studies that suggest that metformin may have anti-cancer properties. So we can conclude that metformin does not cause cancer. The second question is whether metformin can prevent diabetes. Metformin is often prescribed as a treatment for people with prediabetes, i.e. with high blood sugar levels but who have not yet reached the level to be diagnosed with diabetes. There are studies that show that metformin can reduce the risk of developing diabetes in people with prediabetes. However, it is not a cure for diabetes and cannot be used to prevent diabetes in all cases. The third question is whether metformin attacks the liver. Although metformin is considered safe for most people, there is a small risk of side effects, including liver complications. It is important to remember that most cases of liver damage are mild and reversible and are more likely to occur in people with other underlying liver conditions. Therefore, metformin may pose a risk to the liver, but only in very rare cases. But there is question of whether metformin is bad for health in general. Metformin is generally well tolerated and has few side effects. Here are the most major side effects. The main one is the gastric part. The person may feel nauseous presenting flights, stomach pain, lack of appetite, having diarrhea. Most of the time the diarrhea goes away. A metallic taste in the mouth. Can it give hypoglycemia? It can if you interact with other medications you're taking, so it's important to speak with your doctor before taking metformin. But metformin itself has little risk of hypoglycemia. And the most dangerous side effect is lactic acidosis. It is rare to happen, especially if you use contrast, if you have kidney or liver problems. More serious, and, importantly, alcohol increases the risk of lactic acidosis. So drinking alcohol, especially heavy drinking, increases the risk of lactic acidosis, as well as hypoglycemia. So, if you like a drink, avoid alcohol consumption. Or at least limit. In addition to the previously mentioned issues, metformin has several health benefits. Metformin can help reduce the risk of cardiovascular disease, such as heart attacks and strokes, especially in people with type 2 diabetes. Metformin can also help lower blood pressure and improve insulin sensitivity. In addition, there are studies that suggest that metformin may have mental health benefits, such as reducing the risk of depression and improving cognitive function. Therefore, metformin is an important and useful drug to treat type 2 diabetes and other health conditions. If you are already taking metformin, it is important to continue to follow your doctor's instructions and monitor any side effects that may occur. And if you're considering starting metformin, it's important to discuss with your doctor the risks and benefits in relation to your health condition. So we can conclude that metformin is safe and effective for the treatment of type 2 diabetes and can be used to treat people with prediabetes. However, it's important to remember that metformin can cause side effects in some people and can interact with other medications. Therefore, it is essential to discuss with your doctor before taking any medication, including metformin. So whether your doctor has prescribed it to treat your diabetes or to prevent your prediabetes becomes diabetes, look more fondly at the medicine. But if you thought about taking the medicine to prevent cancer or to increase your longevity, I would not do that. You don't need medicine for that. Eating fruits and vegetables reduce your risk of cancer. Do physical exercise. Less than 150 minutes a week reduces the risk of cancer, reduces the risk of cardiovascular disease, stroke, infarction, increases musculature and reduces fragility. All this is more than proven. Did you like the video? Learned more about metformin? Remember to comment, like and share mainly for those people who already take metformin. Because I think knowledge like that, it is worth it. And what will be the next video you're going to watch? 2 video recommendations will appear for you to watch, and know that knowledge is power and together we can promote a healthier life. Remember to subscribe and until the next video. Thank you very much.